In this video, I'm going to explain how chronic or persistent stress can damage or delay healing the body, with a special focus on the effect of stress on the gut and the microbiome. Hello, my name is Dr. Iggy Soosay, and I'm a functional or integrative medical doctor, and I've been in practice for over 35 years, treating patients, and especially those with gut-related illness. Welcome to my channel, Gut Health for Life, where I'll be discussing all issues related to gut health and the microbiome. This information is for educational purposes only and not to be taken as medical advice. What you will learn from this video is how damaging chronic stress is to the gut, the microbiome, and the brain, and how you can move to heal. But if stress is ignored, it can delay or block healing. But if acknowledged, it could even be a positive influence in your life. I will cover this interesting possibility towards the end of this video. Firstly, I'm going to briefly explain the basics of the stress response. Even if you already know the basics, bear with me as I will go deeper to explain some important signs that could explain the blocks to healing. We all experience stress at one time or another. In the short term, stress is good. It gets you out of trouble. The way the body is designed to respond to any stress is by fighting or running from the source of stress, the so-called fight or flight response. Typically, when exposed to danger, the fight or flight response kicks in. There's an increase in heart rate, the breathing becomes faster, the brain becomes more alert, and there's suppression of all non-essential functions for survival from the danger. Digestion stops, and all energies are diverted to survival. That is, glucose is released from storage to supply fuel for energy, and blood supply is diverted from the gut, from digestion to the muscles. This is exactly how the body responded when our ancestors were faced with the saber-toothed tiger. It is a survival mechanism. The problem starts when the stress is emotional and chronic, meaning long-lasting. The important point to realize is that the body does not differentiate physical stress, that is being chased by a tiger, or emotional stress, such as prolonged work stress, bullying at the workplace or school, or worrying about a chronically sick child. The internal response is exactly the same. Digestion shuts down, the heart rate and breathing rate goes up, but you're not running or fighting. Here the body is in constant and long-term state of stress, in high alert with high cortisol levels that persist, high adrenaline and high blood sugar with nowhere to go, as you're not running or fighting. We could compare this to you putting your car in neutral and stepping hard on the gas pedal and keeping it there all day long and every day from weeks and months, but the car going nowhere. The engine has got to burn out. That is the same with our bodies. We get revved up with cortisol and adrenaline, but going nowhere. If you've been stressed like that, you may have experienced that wired but tired feeling. The difference between the car and humans is that we can adapt to stress. After a period of constant stress, we get used to it mentally, but not physically. Let me explain this further. If, for example, you're under long-term stress, say at a level of 6 out of 10, you're feeling the stress and just coping. And then say a further stress comes on, say a relationship stress or loss of a loved one, and that drives your stress level to a 9 out of 10. After a few months of being at 9 out of 10, you get help and resolve the relationship issue, or with loss, you overcome the grief, and your level of stress drops back to a 6 out of 10. As that stress persists, at this level you definitely feel better than 9 out of 10, and you think you're a lot better. The problem is you've adapted to the level 6 stress. This becomes the new normal, and you feel you're not stressed. But your body is still stressed with all the effects mentioned before: cortisol, adrenaline, blood sugar. It happens constantly that you're used to it. You have adapted. Let's look at what actually is happening in the body. The problems occur with the effects of long-term high cortisol and adrenaline on the body. The production of cortisol and adrenaline happens in the adrenal glands. These are small glands that sit above the kidneys. But the control mechanisms for these hormones happen in the brain. Chronic stress can lead to an overactivation of these control mechanisms in the brain, resulting in a chronically high cortisol and adrenaline. Persistent high levels of cortisol damages the gut lining, leading to leaky gut. I've produced a separate video explaining leaky gut in detail. I will have the link to that video below. Chronic stress also affects the composition and diversity of the gut bacteria, leading to an increase in unfriendly bacteria. Leaky gut allows bacterial toxins to pass through and be absorbed. These toxins trigger inflammation. Inflammation in the brain can lead to anxiety or depression. Depression itself can aggravate inflammation in the gut by stimulating release of inflammatory substances. So here you have a double whammy. The damaged gut can trigger inflammation in the brain, and the inflamed brain can trigger inflammation in the gut. Now, the body has a number of mechanisms to bring balance back or homeostasis. Whilst the fight and flight mechanism is to get you out of immediate physical danger, once the danger is past, there are mechanisms to calm the body down. This important calming mechanism is managed by the vagus nerve. This is a very long nerve that starts from the brain and comes down and acts on the gut, but also the heart and the lungs. Whilst the stress response is fight or flight, the opposite response is rest and digest. So the heart rate drops, the breathing rate decreases, and digestion resumes with blood diverted from the muscles to the gut. Now, if you are in a state of chronic stress that is in fight or flight mode, the body sees this as continuing danger to the body, so it dampens or blocks the effect of the vagus nerve to stop the calming effect. So you continue to be on high alert. The body is unable to get to a state of balance. The high levels of cortisol, in addition to causing a leaky gut, also affect the immune system that can lead to developing allergies, and at the gut level, leading to food allergies. High cortisols can also negatively affect memory, attention, and perception. Not uncommonly, I hear my stressed patients complaining that their memory is not as it used to be, or they have difficulty focusing on tasks. One big cause of chronic stress that I need to highlight is severe childhood trauma. Early life events can set in place a program so that the body negatively responds to unrelated stress in the long term. These life stresses can affect the composition of the gut microbiome and the general health and behavior of the child, and well into adulthood. What can be done to treat the effects of chronic stress? I'm a big proponent of treating root causes, so obviously the source of chronic stress needs to be addressed and eliminated or reduced if possible. This is obviously easier said than done. In my practice, I have some patients who are prepared and are able to make the difficult decisions to rid the body, the source of the stress, but for others, the source of stress is such that they are unable to do that. The psychological effects have to be managed, and these people will need to work with mental health professionals. Whilst mental health is being addressed, the gut-related illnesses can be treated. From the physical treatment, there has been a lot of research showing that probiotics can help heal the leaky gut in chronic stress. Studies have shown that these probiotics can reduce inflammation and in turn reduce anxiety and depression. Some probiotics can increase blood levels of serotonin, which is a neurotransmitter that affects brain functions such as emotion, cognition, memory, pain processing, and sleep cycles. Some probiotics can also increase short-chain fatty acids that can cross into the brain and affect mood and behavior in a positive manner. I explained this very important topic of short-chain fatty acids in more detail in my video on fiber. See the link below. Prebiotics are another group of foods that help balance the microbiome. Prebiotics are defined as indigestible food components that confer a health benefit on the body. They are mainly fibers found in vegetables, legumes, and grains. Simply put, prebiotics are food for the microbiome and so increase the good bacteria and have a dampening effect on the stress response in the gut. They do this by preventing or improving leaky gut and reducing inflammation. An Australian study found that high consumption of fruit and vegetables is associated with lower worries, lower tension, and improves feelings of joy, presumably due to increased fiber intake, meaning increased prebiotic intake. Another study showed that an hour's walk in nature can reduce the stress response in the brain. The Japanese refer to this activity as forest bathing, quite a nice visual phrase. Another activity that helps is laughter. Many studies have been conducted on the effect of humor and laughter on stress, cancer, heart disease, and more. The studies show a positive effect on the immune system and stress hormones decrease. Prolonged stress is not good. It affects the gut by making it leaky and suppresses the immune system. It causes the microbiome to be unbalanced, and these bacteria can affect the brain and cause anxiety and depression. Changes in behavior may be needed to correct the effects of stress with exercise, meditation, change in diet, by increasing intake of fruit and vegetables. Probiotics can also help. Counseling or medication may be needed. Please do not stop any medication you may have been prescribed. before talking to your prescribing doctor. It can be dangerous to suddenly stop medication. I did say at the beginning that I would mention another way to look at stress, where stress could be positive. In her book, The Upside of Stress, Kelly McGonigal argues that our stress mindset shapes everything from the emotions we feel about stress to the way we cope. Defining stress, she writes, and I quote, "Stress is what arises when something you care about is at stake. This definition is big enough to hold both the frustration over traffic and the grief over a loss. It includes your thoughts, emotions, and physical reactions when you're feeling stressed, as well as how you choose to cope with situations you describe as stressful." This definition also highlights an important truth about stress. Stress and meaning are inextricably linked. You don't stress about things you don't care about, and you can't create a meaningful life without experiencing some stress. Food for thought. I hope you found this video useful. I would appreciate comments below, including any particular gut-related topics you would like to see. And please don't forget to subscribe below so you don't miss out on any forthcoming videos. I thank you, and I look forward to seeing you in the next video.